Okay, so we were on to rabies, and probably of the diseases, this one kind of makes people very nervous, rightfully so. It does have um, some pretty severe clinical signs, and obviously, because we can catch it and it can cause severe disease in people, that's kind of why everybody really gets nervous about rabies. But it is also known as acute viral encephalomyelitis because the virus attacks the brain tissue, which can then eventually affect all of the nerves. But it basically starts within the brain, and it's part of the robadoviruses family. And unfortunately, it is fatal. Um, it's a fatal virus. It is transmitted through a bite. Now, I will say, I'm going to talk about the salivation. You have to be careful if you do have open wounds and you are handling an animal that is excessively shedding the virus through their saliva. So, potentially through a wound. Now, intact skin, you typically would be fine. But I know if I was dealing with a rabies or a potential rabies suspect, I'm always going to wear gloves. You could even make the argument you should wear eye protection, potentially have a mask, because, again, coming into contact with the saliva, but the primary route of transmission is through a bite. Now, the incubation period is going to vary. If an animal, typically what happens, if an animal bites something or someone, it's what usually accelerates the virus. And most dogs that are exposed, anywhere from 21 days, which is 3 weeks, up to 80 days, which is almost 3 months, these symptoms can appear. Now, what happens is when the virus takes hold, it travels through the nervous tissue, which would be the nerves or peripheral nerves, through the spinal cord to the brain, but it also spreads through salivary tissue, and that's how it is shed via the salivary glands. And you've probably talked to, because you've talked about this, I'm sure already, but the three stages that we think of is the prodromal, which is the early stage. I think most people associate rabies with the furious or the excitive stage. And then it's going to progress to a paralytic stage. So you do want to know the three stages, even though that's like not necessarily on your homework, but we want to talk about the stages. But animals can vary in those stages. Animals can vary on, it's not like, oh, this happens at 1 week, this happens at 4 weeks. It can vary based on the animal, based on their condition, based on how severely they are affected. There's some notes under here. The prodromal tends to be when you see the changes in behavior. Now, what I told you guys the other day, remember when I was talking about the raccoon that was out in the day, going in circles? That's very out of behavior for a normal raccoon. Sleeps during the day, or they don't just hang out in daylight. So if I see like a possum walking down the street, if I see a raccoon, that's kind of out of character. And so that's that behavioral change that I'm talking about. Um, and dogs and cats can become fearful, twitchy, especially if you have a dog. I mean, I think most people know, like, if your dog is social, if your neighbor's cat is social, and then all of a sudden they become reclusive, apprehensive, fear biting, that could be a potential sign because that's out of character. So what is the normal behavior for your animal? Like I said, my cats that I used to have were very social cats. They're out and about, they're in your face, they're not hiding. So, what is normal for the animal? What is their normal behavior? But this is the stage where the greatest risk of exposure. So you don't have like the furious symptoms. So again, if an animal's fearful and bites, this is kind of what we're talking about. When you go into the furious excitive, they can attack inanimate objects. They can attack a chair, a door. a spindle on a railing. You know, they might go at something. And again, why would they attack something that doesn't normally pose a threat or cause a problem or something they're familiar with in their home? Some animals can be what's called in a stupor. There is a form of rabies called dumb rabies. And it's literally means they're just kind of stuporous. And, you know, to some degree, that raccoon was walking. Now, we don't think that raccoon had rabies, but if it was walking in a circle or stumbling down the street, I mean, if I saw a raccoon stumbling down the street in the middle of the day, yeah, I'm getting concerned. And then eventually what happens, because it goes from the brain tissue, well, encephalitis puts pressure on the brain. When the brain is swollen, you know, the skull does not stretch. So any swelling of brain tissue is going to potentially affect the nerves and then can cause this ascending paralysis. Now, typically it starts in the hind limb. So maybe they're stumbling and weak, and then all of a sudden it progresses up to the forelimbs. The problem is, and any form of paralysis, but of course I'm talking about rabies, but when you talk about paralysis, and if it starts to ascend, we worry about paralysis of the thoracic muscles or the diaphragm. Now, if you get paralysis of the diaphragm, that's kind of like one of the last things to go. If, you know, because if an animal cannot expand its chest to breathe, sometimes the diaphragm will trigger and try, and you can expand the lungs a little bit. But if you have paralysis of thoracic muscles, if you have paralysis of the diaphragm and they can't breathe, then that's exactly, you know, what's going to happen with the death. And sometimes they can accelerate in all of these stages within a week. That's why it's variable. I can't say week 1 is always this many days, stage 2 is always this, you know, it can vary. And obviously, if I look at a patient like this, I'm kind of like, well, I'm kind of really wanting to stay away from it. You can see the, you know, and look at all the salivation on the fur around the mouth. Sick mouth. They get this sticky saliva. Their mouth is kind of clinchy, but they've got all this saliva. Now, if I see a dog like this that comes in, is there anything else you would be thinking about this dog? Well, did it eat something strange? Did it get into a poisonous plant? Did it get into something like cleaner in the mouth? Did it shock? Sometimes animals bite an electrical cord. You know, like if somebody comes in and says, oh my God, my dog is acting weird and it's salivating, you have to keep this, you know, has your dog been outside? Did it get into a fight with a wild animal? Did it, you know, hopefully there's something in the history pointing to rabies. But if an animal comes in with excess salivation, you have to always be thinking, what are other things? But again, sometimes when we suspect infectious disease, they have to be guilty till proven innocent. I mean, you have to handle a dog like this extremely carefully until you can get a full history. You know, if a dog looks like this and they're completely vaccinated and they've been indoors, it would be extremely rare for them to have rabies. But when you're handling them, you have to be careful if this is on the list, you know. So you always have to keep this in the back of your mind when we're dealing with this. And I don't know, you know, it's an old movie. I don't know if you guys have ever seen the movie Cujo, which, you know, is an old Stephen King movie about basically a rabid Saint Bernard. Or has anybody seen Cujo? Am I really aging my, oh my gosh, Alyssa, I was like, if I would have seen a Saint Bernard when I was a kid and I saw that movie, it's so scary. It's a very scary movie. You know, so yeah, that's it. That's basically a big rabid Saint Bernard that terrorizes this farm, and it's terrible. So that's why sometimes people get, you know, say, oh my God, that dog's acting like Cujo, or we joke around, or I've actually had clients bring their dog in named Cujo. And you're just like, and sometimes there was something on Facebook recently that was funny. They're like, dogs named Fluffy and they're aggressive, and dogs named Killer and they're like all sweet, you know? So sometimes the name doesn't always apply to the pet, which I think is funny. But yeah, Cujo, the name Cujo came from this movie about this rabid Saint Bernard. So it was quite scary. So if we're thinking, if we're talking about, so this is a canine lecture, but a lot of this pertains to cats as well. Any animal can be exposed to rabies. Any, a horse, a cow, a goat, a dog, a cat, they can all be exposed. I mean, obviously I'm focusing on the dog right now. So anything I'm talking about, the number one thing is the CNS disturbances, central nervous system, because it attacks the brain tissue and then it can progress to the peripheral nerves and salivation. So one thing I always think of, CNS disturbances and hypersalivation. They just salivate excessively, and it almost is a very foamy, sticky, and I mean, they're just soaked. Their mouth, their chest, they're just usually soaked with saliva. And that obviously the change in attitude. So if a client says, all of a sudden they're apprehensive, they're not engaging, or they're doing things out of their normal behavior, those are all big red flags. Especially, again, if they start to be biting or snapping, or they're like chewing at something that's like not even there. Excitability, irritability and viciousness, and especially in a dog that is not normally that way. Normally if your dog is extremely social and friendly, most people will know, do you have a dog that is not, not sociable? And hopefully people will tell you that. And again, when you get to the changes, you start to see the muscle incoordination or the disorientation. They don't seem like they know. They're stumbling, stuporous. Now, you can see seizures. So it can actually, where the seizure comes from is the pressure on the brain. Because this causes encephalitis, the swelling of the brain can actually, they don't always have seizures, but it can progress to a seizure. And then again, the late stage of rabies would be this paralysis that, again, it's ascending. So it starts in the back and the paralysis moves its way. And sometimes people, now you'll probably see more of these signs, but potentially a change in the bark. I think we all know, if you have a dog, I mean, AJ has the yippy bark when he wants to play with Bo, and then he has his deep bark when somebody's at the door and he's very angry. And sorry, he's playing with a bone behind me, so he keeps dropping it on the floor. But if the tone changes, what happens is the muscle tone and the nervous control, if you remember, the vocal cords are kind of like guitar strings and they can change their tension, but the nervous system control is altered. And so it actually, when they bark, it has a different pitch. And it comes from a change in those vocal cords. They're able to change tone in a normal animal, but if that's affected by the nervous system, it can actually make their bark sound different. So, you think of something in the throat, why all of a sudden is my dog's bark changing? That would be, some other things on here: unusual shyness, biting at cage, wanting to roam, but it can start with apprehension and nervousness too. What's hard in cats is, because I've told you guys, cats don't show signs of illness. They like to hide, and that can be for a variety of illnesses, but again, if you have a normally social animal, one that's out with you all the time in the living room, and they just withdraw, they want to hide, they want to stay in their cage, they don't want to come out, these are things. Now, sometimes to diagnose, it's difficult in the early stages. Basically, to diagnose rabies, it's going to be really history and clinical signs. Because did the animal get a hold of a raccoon? Did you see it eating a carcass? Did you find a carcass of something in the yard? Did you see a raccoon or a possum bite your dog, because sometimes, like I said, my dogs run outside and, they're going to potentially attack anything. So did do they have access to raccoons and possums and things? I back up to woods, so the chance that my dogs have access, I've seen raccoons, I've seen possums, we have bats. I've been outside at night and I've seen them fly by. So we have bats, you know but again, what is their environment? What do they have access to? What signs are they showing? But the only way to definitively, unfortunately, diagnose is you have to diagnose it off of brain tissue. And if you suspect rabies, the animal, unfortunately, needs to be euthanized, and you cut off the head and submit the head for the testing of brain tissue. Now, you do not open the skull and try to take a piece of the brain. We just don't do that. Unfortunately, they want the whole head, and you don't want to expose anybody in the hospital to the brain tissue. So typically they just want the head of the animal, usually packed on ice, taken to the disease lab in your state. This is not done in your clinic. This is sent to a disease lab. Now, this is a reportable disease, or this is, they have to track it. If your dog was rabies positive, it's almost like contact tracing, like we talk about coronavirus. Like if I had corona, who are you around? Where were you? Did you have anybody at your house? If I have a rabid dog, did they have access to the neighbor dog? Do they have to contact them? Do we have to worry about, that? But that's unfortunately the only way, is you do an immunofluorescence microscopy on the brain tissue, and it has to be fresh. I believe you have to send it pretty much within a 24-hour period. You cannot freeze. You cannot freeze the brain and send it next week. I mean, it has to be fresh. So it has to be chilled, not frozen. And it has to be a fresh head, chilled, sent within 24 hours to the lab. And they're going to be looking at this antigen antibody reaction within the brain tissue. So, definitive way to diagnose it. Now, part of what you guys are doing with this rabies SOP protocol is, what do we do when an animal bites someone? And inevitably, at a clinic, you're going to get a phone call like, my cat bit the neighbor. Okay, my dog bit my son. We have people at school that have gotten bit by kennel animals. And so there is a process that happens when a bite occurs. So if you have a healthy dog that bites, potentially scratches, they need to be watched for a period of 10 days. A 10-day quarantine is the standard. So normally they are put, now if we're quarantining an animal at home, if they're healthy, like, they can let them outside in their yard to go to the bathroom, but they are not to go to the vet clinic. They're not to go to the dog park or boarding facility. They pretty much are in the home. And when they're in the home, you want to try to keep them away from other dogs or cats. So I usually say you might have to get a kennel. You might have to put them in a laundry room, but you're not out walking the neighborhood. I mean, maybe just a small yard to do their business and bring them inside. And if there's no illness, typically within 10 days, then there's probably no exposure to rabies. Because if they bite and they have rabies, most animals will show signs within those 10 days. Now, this is if they're healthy and vaccinated. I guess it says healthy, but I guess if your dog or cat is vaccinated, and rabies is the only vaccine that's required in the state. Other vaccines are recommended, but if you own a dog or a cat, they are supposed to have a rabies vaccine. And I know sometimes even with my cats, I haven't always been great about other vaccines. They get their rabies because you just don't want to mess with this, especially if they're outdoor cat. You just want to be cautious. And dogs and cats, they don't shed more than 3 days typically before they develop disease. So that's why we want to get them in that 10-day window. Now, if they're unvaccinated, so you have your dog that doesn't have a rabies vaccine, we don't know when a rabies vaccine was given, or a cat that has bitten and is unvaccinated, or we know that they did have access to a rabid animal. If we saw evidence of a carcass, we saw something bite our dog and cat, they can be quarantined for up to 6 months. But different states do have different regulations for this, but it can be up to a 6-month quarantine. Yeah, which is difficult because you're pretty much, that animal is supposed to remain in your house and not really go anywhere for 6 months. So again, this is why we get these phone calls, and this is why clinics typically have an SOP, which is a standard operating procedure. So normally you can go to the binder, your clinic usually has a binder that has information, or what do we do if this, or this happens. You go to it and you can follow the rule. Luckily, it's fairly, household bleach will kill this. So if you do the 1:32 dilution, which is basically 4 ounces of bleach, household bleach in 1 gallon, or 4 ounces per gallon, and then clean any surface. So bowls, cage doors, the cage, the floor, where did that animal, and again, remember, this is saliva. And when they shake their head, and saliva can go anywhere, that's why you have to be really cautious and make sure you clean very well. So are there any questions about rabies? And I will say rabies vaccines are typically once a year. There is a 3-year rabies that you can give that is good for 3 years. Obviously, it's a little more expensive, but then you don't have to take them in, as often. You can do a 3-year rabies. Okay. So leptospirosis, which is, now we're kind of talking about the ones that are not your core vaccines, and leptospirosis is caused, and this is what it looks like. It's caused by a spirochete bacteria. Now there's different types of lepto. Icterohemorrhagiae, icterus hemorrhage. Canicola Pomona. I just want you to know leptospirosis as a group. You don't have to know the individual leptospiro, but it is a spirochete bacteria. And a spirochete is a spiral. Leptospirosis, spiral. So it is a spirochete bacteria. And they are aerobic. And again, when you guys, Clin Lab 4 is when you do microbiology. And typically, so if a bacteria is aerobic, they need oxygen to survive. If it's an anaerobic, which means without oxygen, they can survive in deeper tissues, and they need to thrive in an unoxygenated environment. So this needs air. It's aerobic, and it's gram-negative. And typically your gram-negative infections are a little bit stronger. Gram-positive is like staph on your skin. That's a gram-positive bacteria. Usually not as virulent, but this is not. This is gram-negative, spiral-shaped spirochete bacteria. It does not typically multiply outside the host. So it has to be, we're going to talk about it being ingested, but it has to multiply once it's inside the host. But so it is susceptible. It's fairly easy to kill. Drying out is going to kill it. pH changes, lower than 6, which is acidic, higher than 8, which is alkaline. And then varying temperatures, but where it loves is wet conditions, up to 180 days in wet soil. And it absolutely loves stagnant water, alkaline environment. Now, the number one thing I think about when I think about leptospirosis is that it is shed in the urine of rodents, other infected animals, possums, raccoons. And when you think about standing water, for example, pond water, basically if you have runoff from the woods and these wild animals urinate, and I think about standing water, your dog steps in a puddle out by the woods, licks their paws, or they drink from that puddle. That's typically how it's going to be spread. So it's going to enter through the GI tract. It can penetrate mucous membranes, or if you have a cut, like I'm very bad. I have dry cuticles and I tend to like pick at my cuticles and I have like a cut basically on 3 of my fingers. If I handle an animal with leptospirosis, it can get into all these little cuts on my fingers. Or if you have a cut, like you were cutting something at home and you have, so broken skin, intact skin, it's not going to penetrate intact skin. But if you have an abrasion like a scrape, a torn cuticle, a cut, it can get in. It can get splashed into your mouth. It can get splashed into your eye because the inside of your eye is a mucous membrane. Your mouth is a mucous membrane. A cut in your skin exposes blood vessels. It is zoonotic. It is very zoonotic. So you have to be very, very careful if we have lepto as a suspected illness. So typically animals, there's going to be several days of not eating, anorexia, and if they're not drinking, they're going to get dehydrated. They start to vomit, which furthers the dehydration, makes it worse. And then they just become lethargic and depressed. Now, all of those clinical signs are extremely vague, right? You know, that could be like 100 diseases. But then it progresses to muscle pain and can progress to some diarrhea. Potentially, you can see hematuria or blood in the urine. But a lot of times they also have a fever. So they can be as high as 103 or 104. As they keep progressing, when this bacteria invades the body, it's going to start to attack the liver and kidney. And basically, anytime you affect the liver, petechial and ecchymosis. So ecchymotic hemorrhages, ecchymosis is when you get bleeding hemorrhages like in the gums or in the conjunctiva of the eye. So you see the little pinpoint, they're like little micro bleeds. And obviously petechia are the little bruises under the skin. So it can affect the liver and clotting. And then and that's where we start to see the hematuria, the petechia, and the ecchymosis. In its later stages, they can actually become jaundiced and actually have abdominal pain, because what happens is it can swell the liver, which makes their abdomen feel tender because it's inflamed and it's painful. But this can progress to renal failure and death. And this is what we worry about. I would say sometimes by the time the owner comes in, and being at a specialty center, sometimes they came in for renal problems. They started showing renal signs, and all these signs can happen because the kidneys are affected. And then by the time we diagnose them in renal failure, we find out it was from leptospirosis. So we have to be careful with this one. So diagnosis, what you're typically going to do is do an antibody titer. Can we find it in the specimen? So you can do a leptospiro microscopic agglutination test in the acute stage. And then you follow up with the serum sample, and this has to be sent to the lab. So this is all going to be sent typically to the lab to be diagnosed. So it's not like we have an in-house SNAP test that's like, oh, they're positive, So you can do a fluorescent antibody to test usually for antibodies. This leptospiroagglutination test, but we're looking for increase in titers. Now, you guys will do virology in Clin Lab 4, but whenever you look at titers, titers have to be evaluated kind of with a grain of salt, because sometimes there's a low titer, which may mean the animal was exposed and they made antibodies, but do they have current infection? So a lot of times it's going to depend how strong the titer is. That's why sometimes titer testing is difficult to express or to explain to owners, because we're dealing with sometimes, were they just exposed? Do they have active disease? Now, obviously, if an animal's showing those clinical signs, it probably has active disease. Treating this is typically these animals go on IV fluids and a penicillin type antibiotic, usually ampicillin, sometimes amoxicillin. So ampicillin, we have an IV form of this, and they're usually on IV fluids, and they're getting this. They can be on tetracycline, but you have to wait till the kidney function is stable, because tetracycline is metabolized in the kidneys. So if you have an animal that has, they're borderline renal failure, you're probably going to start with different antibiotics versus tetracycline, because their kidneys cannot handle that medication. And usually they're going to be put on an antiemetic, so that's to prevent vomiting so that they can start to keep food down, which would be like Serenia. Now, let me give you guys a real world example. Anytime an animal has elevated kidney enzymes, that also makes them feel nauseous. The IV fluids are going to help flush the kidneys. They're going to help flush out those enzymes. That's why they usually need to be on IV fluids. And if you can put them on anti-nausea or the antiemetics and do IV fluids, hopefully you make them feel better enough they'll start to eat. Because again, now this is not a virus, this is a bacteria. So we do have medicine to kill the bacteria. We just hope we catch it before the kidneys are too far gone. And let me give you another practical tip, because I don't know if you talked about it in your other class, but so we had a case of a dog that came in for suspected renal failure at VCA. And it wasn't till like 3 days later, I remember coming into ICU, and there were signs everywhere and emails to the staff that says, if you handled this dog is now a lepto suspect. So the clinical signs progressed, but now for 3 days, people have been handling the urine, and it is zoonotic. So they had to trace, we all had to go to management and be like, have you been in with that dog? Because I can tell you, most of the time we don't wear gloves. There's most of the things, thankfully, that animals have are not contagious. There's a handful. So not everybody wears gloves. In human medicine, everybody's constantly wearing gloves. So we had to all backtrack and be like, this dog's been hospitalized, and you've potentially been handling this dog, and it ended up being lepto positive. So luckily, I don't think anybody got sick, and that dog, I remember, that dog would pee a lake. Well, it was on high dose fluids for its kidneys, and inevitably it would urinate in its cage. It felt like crud. So it didn't usually want to go outside. It would just pee in its bedding. So I'm thinking about all the people that picked up that urine-soaked bedding, that picked it up. And obviously, if I handle urine-soaked bedding, I put on gloves. But the chance that, sometimes I hate to say this, sometimes you fling a towel in the laundry and it flings. And so everybody had to kind of think back, like, did I get urine on me from that dog? Did that dog potentially urinate on me? So this is another disease that's sometimes guilty until proven innocent. Does the dog get into ponds and swim in ponds in forests or on property? Like I said, my dog loves to go out and find a puddle. AJ drinks like a gallon of water a day, so he sees standing water. I'm always like, because I live by the woods, I'm constantly pulling him. I'm like, oh God, no standing water. I'm constantly getting him away from it. Now, there is a lepto vaccine, but it is not recommended for everybody. I did vaccinate, I will say, I did vaccinate Bo for lepto last year because of being by woods, having wild animals. They could pee in a puddle in my yard and my dog steps in it, licks their paws. I was like, my dog is at high enough risk. Your dog lives in an apartment, you go to a little park, you probably, yeah, yeah, anytime, if you have a yard, raccoons and possums are everywhere, mice, rats, so you don't necessarily just have to be by woods, but like you said, like Morgan said, my dog has access to walking in the woods, and inevitably they're going to find a puddle, and I try to keep them out of it. They don't really go swimming in ponds, but the neighborhood next door has like these little standing, a little reservoir ponds, and anything can go over there and pee. So there is risk. When Bo got the vaccine, what's interesting is he had a reaction to the vaccine. He didn't react to his other vaccines, but he came home and he vomited 5 times in an hour. And I was like, what on earth? Like, he just kept vomiting, 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 vomiting. And I was like, what changed? He got a lepto vaccine. I didn't change his food. He didn't get in the trash. I was like, why are you vomiting out of the blue? So I haven't decided if I'm going to give him one this year because, Dr. Ritz was like, we could give him Benadryl like an hour before, and hopefully he wouldn't. Now, he didn't get swollen and swell up like an anaphylactic reaction, but he did have this like hour of vomiting that was pretty violent vomiting. I was like, okay, maybe I'm not going to do it. Maybe I'm just going to keep him out of puddles. But it can go to the kidneys, so you do want to be cautious with it. And like I said, lepto is one of the things I worry when I work with a lepto suspect dog. You just have to be more on your game. Did I get it on me? Did I get it, as I sit here and like play with my cuticles? But I would wear gloves. Sometimes I even double glove. And like I said, think about this. If you're in a cage and the dog like soaks his run and then he shakes his tail and he's like all happy, you inevitably sometimes get flung with things. So just be cautious. Well, I know it's 2:13, but before I bop into kennel cough, I think I will stop there. Do you have any questions?